In this presentation, I'm going to talk about oral health strategies for the pregnant patient. I can tell you that this is an area in particular where I think dentistry has done an extremely poor job in getting the educational message as to what the implications of oral health during pregnancy are. And so I want to touch on some of those, okay? It's a little bit complex. Pregnant women are particularly prone to periodontal disease due to hormonal changes. This is perfectly normal. There's a thing that's called pregnancy gingivitis, your gums bleed. I mean, it's not something that is super alarming, but it's something that you need to be aware of. But this level of gum disease puts you at risk for delivering a preterm low birth rate infant, okay? That is well documented. And so the research believes that the bacterial infection in the mouth can enter the bloodstream and cross the placental barrier, causing inflammation and preeclampsia or labor. And the bacteria is PG. You know, we talked about PG over and over and over again. So we want to go through your history, determine what your current periodontal condition is, and screen for the pathogens implicated in this risk. These are advanced salivary diagnostics, the oral DNA tests that we can do. Salivary diagnostics, this is a completely different thing. So we have, in the pregnant patient, you've got two things going on that we need to be aware of. We need to be aware of the gum issue, the bleeding and the gum disease. The other thing that we need to be aware of, and this is a conversation that dentistry has never had with any significance with pregnant mothers, the strep bacteria, the bacteria that cause tooth decay. The primary way that infants and young children get it is from the mother. That's the transmission. It's transmissible from the mother to the child. That's where tooth decay comes from, okay? So if you have an out of control level of strep mutans, as a pregnant mother, you are assuring a significant dental problem very early for your kid, okay? So these are some of the oral pathogens that are implicated in the preeclampsia. The objective is to reduce the bad bacteria in your mouth, whether it's the decay bacteria, the gum disease bacteria. But the pregnant patient is a little bit tricky because you're going to have to address both of those, okay? So once again, the oral disinfection protocol that we have developed, it's very similar for most patients. I want to make one comment here on a book that I've read in the past year, a fascinating book that's called Nutrition and Physical Degeneration, that was written by Weston Price in the 1930s. This is a dentist. Weston Price was a dentist. And he looks at the nutritional components in dental development. He makes a very compelling case in how prenatal nutrition is absolutely essential for the proper formation of the jaws, the width of the jaws, so that you don't have crowding when the teeth come in. It's a really fascinating read. He's got 10 years worth of research back in the 30s, and it's a very compelling argument that's, you know, I didn't read about that in dental school. Someone told me about Weston Price, and it's very fascinating. But coming back to this whole concept of pregnancy and dental issues, there's a lot to it, okay? There's a lot to it. So we're going to try to craft a home care regimen that addresses both the strep issues, okay, and also the periodontal challenges that you might have with bleeding gums. Both of these have implications. They have implications as to when childbirth will happen, but there's also an implication afterwards as far as the risk factors that are carried or that are passed on to your children almost immediately, okay? And that's a conversation that's never really been properly discussed with mothers, is how their oral health directly affects their children's oral health. I think if we had that conversation a little bit more effectively, because I know how much mothers universally care about their children. I think that's an approach that we've been a little bit deficient on, and hopefully we can do a better job.